Intestinal obstruction is a serious medical condition. It happens when something blocks your intestines. This blockage prevents food and fluid from passing through. Intestinal obstruction can occur in the small intestine or the large intestine, also known as the colon. It requires prompt medical attention. Imagine your intestines as a highway. Food and fluids travel along this highway to provide your body with nutrients. An intestinal obstruction is like a roadblock on this highway. This blockage can cause severe pain and complications if not treated quickly. There are two main types of intestinal obstruction, mechanical and non-mechanical. Mechanical obstruction is when there's a physical blockage. Non-mechanical obstruction occurs when the intestines stop working properly. The location and severity of the blockage can determine the specific symptoms you experience. However, common signs include severe abdominal pain, bloating, vomiting, and an inability to pass gas or stool. Understanding the causes and symptoms of intestinal obstruction is crucial for early detection and treatment. Mechanical obstruction is a physical blockage of the intestines. Several factors can lead to this type of obstruction. Adhesions are a common cause. These are bands of scar tissue that can form after abdominal surgery. Hernias, which occur when part of the intestine protrudes through a weak spot in the abdominal wall, can also lead to blockages. Tumors, both cancerous and non-cancerous, can grow in the intestines and obstruct the passage of food and fluids. Volvulus, a twisting of the intestine, is another possible cause. Lastly, intussusception, a condition where a part of the intestine telescopes into an adjacent part, and strictures, which are narrowings of the intestine, can also result in mechanical obstruction. Recognizing these potential causes can help individuals seek medical attention promptly if they experience symptoms.
This video was proudly sponsored by GoLogin, the best browser for multi-accounting. Ladies and gentlemen, let's get back to our video.
Unlike mechanical obstruction, non-mechanical obstruction doesn't involve a physical blockage. Instead, it occurs when the intestines themselves fail to function correctly. One of the primary causes is ileus, a condition where the normal muscular contractions of the intestines are impaired. This can happen after abdominal surgery due to certain medications or as a result of infections. Neurological disorders, such as Parkinson's disease or spinal cord injuries, can also disrupt the nerve signals that control intestinal movement, leading to obstruction. Symptoms of intestinal obstruction can vary depending on the location and severity of the blockage. Abdominal pain is a hallmark symptom, often described as cramping and intermittent. Bloating and abdominal distension are also common. Vomiting may occur, and if the obstruction is high in the intestine, the vomit may contain fecal matter. Constipation, particularly the inability to pass gas or have a bowel movement, is a red flag. Additionally, dehydration due to vomiting and reduced fluid absorption can occur, leading to fatigue and dizziness. Diagnosing intestinal obstruction typically involves a combination of physical examination and imaging tests. Doctors will first examine the patient's abdomen, checking for tenderness, distension, and bowel sounds. Imaging tests are crucial for confirming the diagnosis and identifying the location and cause of the obstruction. X-rays can reveal distended loops of intestine, while CT scans provide more detailed images that can pinpoint the exact site and nature of the blockage. In some cases, ultrasounds may be used, particularly in children suspected of having intussusception. Treatment for intestinal obstruction depends on the underlying cause and the severity of the condition. Conservative management is often the first line of treatment for less severe cases. This may involve resting the bowel by not eating or drinking, also known as NPO, administering intravenous fluids to correct dehydration and electrolyte imbalances, and using a nasogastric tube to decompress the intestine by removing excess fluid and gas. Medications may be given to manage pain and treat underlying conditions such as infections. However, if conservative measures fail or if the obstruction is severe, surgery may be necessary. Surgical interventions can involve removing the blockage, such as adhesions or tumors, repairing hernias, or resecting damaged sections of the intestine.